Welcome back, everyone. This week, Texas voters overwhelmingly approved the creation of a new state agency dedicated to researching dementia.
Proposition 14 will establish DPRIT, that stands for the Dementia Prevention Research Institute of Texas. So joining us now to talk about what this could mean for Texans is Dr. Sid O'Bryant. He's known as the brain care doc at the University of North Texas Health Science Center at Fort Worth. So doctor, thank you so much for joining us today to dig into this topic.
Thanks for having me. It's a pleasure to be here.
You celebrated the passage of Prop 14 and DPRIT getting off the ground. So talk to folks about why you think this is so beneficial for the state of Texas.
It's hard to even articulate how important this is. Texas has taken such a huge stance in terms of how do we advance care and research in dementia when timing is most important. We have more people dealing with the disease. Texas has a large number of patients that need help, and the people of Texas standing up to support this is just amazing.
This is a constitutional amendment, and eventually it will allow Texas to award $3 billion in grants. So, Doctor, what are your expectations about where this money will go? Do you have any ideas about where you would like to see it go?
Absolutely. There are so many, in the last 10 years, Texas has recruited and grown so many amazing scientists across the state. And I really expect this work to span the gamut. So I think we're going to see basic science research going after how to develop new therapies from drugs to non-drugs. We will see things that are advancing respite care for those dealing with and helping their loved ones. And I really think we're going to see a lot of funds going towards how do we look at either interventions from medication, lifestyle, or others for how do we prevent the disease in the first place among Texans. So this work, no different than what CPRIT did for cancer for Texas. DPRIT is going to rapidly advance broad scale science that's going to lead to better therapies. And that's what it's about, helping our patients.
It's our understanding your own work has really focused on the impacts of Alzheimer's in particular. So what more has your own research discovered, and then what would you like to see maybe forwarded now that Texas is getting this infusion of attention on this disease?
I'm blessed to run one of the largest Alzheimer's research programs in Texas and in the country. And so our own research has very clearly in the last 5 years shown that dementia and Alzheimer's in particular is way more complicated. It's not one thing. And that's a blessing because we now have data looking at how diabetes impacts Alzheimer's among certain groups of people, hypertension among others. So that precision medicine, how do we treat your Alzheimer's disease? That to me is, I think, the single biggest opportunity that DPRIT offers the state of Texas and the United States and the globe of how do we target your risk, your Alzheimer's, and treat your loved ones. And that's what our science has shown very clearly. And that's what I think is going to be advanced most.
Well, Dr. O'Brien, is the ultimate goal for researchers to find a cure for Alzheimer's? Do you think that at the end of the day is the end goal?
I think we will find a day of optimal brain health for all. We can beat this disease. Yes, absolutely. That's the goal. We're going to learn how to stop it, and then we're going to learn how to prevent it.
Really incredible. You mentioned it off the top, but talk just a little bit so people understand the magnitude of how many folks in Texas are affected by this, and then as our population ages, I imagine it will touch almost everyone's lives. But if you could give us a look inside just what this means for Texans.
Texas has over pushing 400,000 people diagnosed with Alzheimer's disease. And when you span that out to the pre-Alzheimer's disease, it's going to be even more. Then there's the dementias that may look like but may not be Alzheimer's disease. And so just from a patient standpoint, there's over 500,000 just in the state of Texas. But dementia and Alzheimer's isn't just a disease that impacts the patient, it impacts the family and the community. And so the impact in Texas in terms of even the financial burden because of people taking care of their loved ones and no longer being able to work, that has a financial impact on this state. Then there's the care components of it. So that's one of the reasons that this is so important, is because there's such a complicated infrastructure where someone suffering from the disease needs so much help, but the family needs help. And by getting in there and doing these more targeted precision medicine and even prevention efforts, it's going to have a huge economic benefit. And honestly, one of the other things this DPRIT is going to bring is matching funds from other sources outside the state. Companies are going to start coming in and partnering. Federal funds are going to become available. So, I mean, there's so much we can do, and the impact on Texas is huge. And so, in our own group, we're going after Alzheimer's specifically among veterans because we have the largest veteran population in the United States.
Right.
And so, this is important, and it's just groundbreaking. You can tell I'm excited.
Yes, very much so. It's palpable there. So that was Dr. Sid O'Bryant with the University of North Texas Health Science Center at Fort Worth. Doctor, thanks again for joining us and for sharing more about that perspective. It's been very helpful today. So thank you.
Thank you for having me.